Okay, I do that.
Hi, good afternoon, everyone, and thank you for spending your valuable time to join me in this webinar to listen to my sharing. I'm Dr. Tiong, orthopedic surgeon from Nilai Medical Center, and today I'll be talking about the common orthopedic hand and upper limb conditions. I'll be talking for about less than 30 minutes regarding this topic, and there will be a short question and answer sessions after this. Please feel free to ask me any question in your mind. Okay, before that, I would like to take this opportunity to thanks Nilai Medical Center for giving me this opportunity to share my knowledge. Let's start. Today, the topics that I'll be talking about is mainly trigger fingers, carpal tunnel syndrome, ganglion cyst, Quervain tenosynovitis, or easily we mention as Quervain's disease, and tennis elbow. I'm sure some of you might have heard this or seen this from your relative, family, or even friends. Hopefully, after this talk, you'll know more about these 5 conditions and how can you prevent this, and what are the treatments that are available for these conditions. As for this CMO period, the control movement order period, many companies has asked their employees to work from home. This involves a lot of sitting in front of computers, using computer keyboards and mouse. And some of these conditions are more prone in people who uses a lot of computer keyboards and mouse. So, okay, let's start from the first topic. Trigger fingers. What is a trigger finger? Okay, before that, let's start with some anatomy. Okay, our movement of fingers to bend, to curl, and to straighten our fingers are moved by tendons, which stay inside its cowl. Okay, there are tendons in front of the fingers and the back fingers to flex, to curl, or to straighten the fingers. Usually, in normal situations, there will be a very smooth gliding of the tendon within its cowl. Thus, there's no problems. Problems comes when there's mismatch between the tendon and its cowl. It's either the tendon become inflamed and swollen, or the cowl become thickened and tightened. Okay, so you can see in the pictures on the right hand side, our pulley, our cowl of the tendons are made of multiple pulley, and the problems of trigger finger come from the A1 pulley, which is in purple or blue color. Is actually at this level in front of our knuckle. Okay, these are where the problems of trigger fingers occurs. What causes trigger fingers? Is caused by repetitive movement or forceful use of the fingers. It can be caused by inflammation of tissue in the hand, or secondary to connective tissue disease like rheumatoid arthritis. Who is at risk? As I mentioned just now, those people who work in front of computers like admin and office worker, they use a lot of computer keyboards and mouse, they are prone to have these trigger fingers. Besides that, like construction workers or manual labor workers, which involve a lot of forceful gripping and heavy lifting, they are prone as well. And another group of people who get this is assembly line workers and manufacturing and factory workers, like for example, clothing or electrical appliances factory workers. And how do I know if I have trigger fingers? This condition usually are progressive. Usually it starts with some pain or discomfort over this level in front of the knuckle and some stiffness. Patient can present with painful clicking, catching, hopping, or snapping of fingers when try to bend or straighten the fingers. Okay, for example, when patient can have bend it and they have difficulty to straighten the fingers smoothly, so they probably have this click. Okay, that's a very common presentation of trigger fingers. And at one stage, the finger can be locked in flex or straight positions. If it's locked in flex or bend positions, patient cannot straighten the fingers by itself. It may need the other hand to straighten the fingers, or in worst stage, patient may not even able to straighten the fingers with the other hand. It may need surgery. So for examination wise, at this level, you can feel some nodules of swelling and there will be tenderness when you press here. How frequent is this? Out of 100 people, about 2 to 3% will have this, and this condition is more common in diabetic patients. So in diabetic patients, they can even have multiple fingers having these trigger fingers. Women are more affected than men, and usually these conditions happen in patients in 55 to 60 years old. All fingers can have these problems, but the commonest fingers that will have trigger finger is thumb, ring, and middle fingers. All right. Okay, this is the severity classification. It can start from very mild condition and up to grade 4 become very severe. Patient can have just pain and stiffness over this area. Okay, and grade 2, when the patient got catching of the fingers, you have to catch the fingers to straighten the fingers. Grade 3 is when the patient have locking and unable to passively, means that you need the other fingers to straighten it. Grade 4 is when you are unable to straighten it whatsoever because of pain, and you will need surgery because of that. So what can you do before you see a doctor? Activity modifications and reduce symptoms which can cause this, reduce activities which can cause these symptoms. And the other one next is NSAID or non-steroidal anti-inflammatory drugs. This medication acts as a painkiller and also anti-inflammation to reduce the inflammations. The next one is tendon gliding exercise. This is very important and it's very useful especially for mild cases. Okay, you can do this exercise at home, and a lot of mild cases can just resolve with this exercise, and you don't even have to come to the doctor. You can do this, this, as in the picture you can see. Every posture of this you can maintain for 5 to 10 seconds. Okay, and the whole cycle you repeat about 20 times in the morning and 20 times at night. What if all this you can't resolve your problem? Then you have to go and see an orthopedic surgeon. What the doctor can do for you? The first thing on the line is steroid injection. It can resolve the problem about 60% of the patients. Diabetic patient may respond less because diabetic patient may respond less favorably. And if you have been having this trigger finger for the past 30 minutes, you have been having this problem for a long time, like probably many months or many years, the result with steroid injection may be even less. So what the risk of steroid injection is? Steroid injection have this common complication like fat atrophy. If you inject into the tendon accidentally, it can cause tendon to tear, or skin discoloration. You may have a spot of whitish discoloration after injection, or you can even have infection if it's not done properly. And surgery, if steroid injection doesn't work, surgical release is the gold standard. The success rate is very high, more than 90%. Usually you just make a small incision about 1 centimeter over here. As you can see in the pictures, and lower down, the wound is about 1 to maybe 1.5 centimeter, and after a few months, the wound is barely visible on the right-hand side of the chest. This surgery can be done under local anesthesia, usually done under day care, which means you can go back on the same day. Removal suture about 10 to 14 days, and you can start moving the finger almost immediately. You may or may not need physiotherapy, depends how long you'll be having these trigger fingers. What happens if you seek treatment late? Finger can get stiff and lock and flex in a curl position. You have difficulty doing work and daily activities. If you seek the treatment late, conservative management most likely will not be useful, and injection may not be beneficial. Surgery will still give you good result, but recovery may take longer than usual. So next we go to carpal tunnel syndrome. What is carpal tunnel? As you can see the pictures, it's a conditions in the wrist. It's a tunnel in the wrist where our median nerve pass through the tunnel, enclosed space to provide for movement and sensory or sensation to the hand. Okay, when this small tunnel or small area is compressed due to a disease, it can cause median nerve problems. What can cause this? Usually caused by repetitive motions like typing, like MCO. You work from home a lot, you type a lot, you're prone to this. Other conditions that can cause this like hypothyroidism, obesity, rheumatoid arthritis, or diabetes. Even pregnancy, because in pregnancy state, patient will get swollen tissue a lot, so they can cause this compression or constricted space here, causing a carpal tunnel. Sports like sports which involve a lot of gripping or flex in curl will risk a lot, like cycling, tennis, throwing sport are also prone to carpal tunnel. Swelling and lesion within the carpal tunnel, like gout or ganglion, can cause this. So how do you know that you have carpal tunnel syndrome? Okay, as mentioned, median nerve or carpal tunnel syndrome is the most common nerve being compressed in the body. Okay, patient will complain of burning or numbness or tingling in the palm in these 3 fingers and maybe half of these fingers, 4 fingers. Patient can present with weakness of the hand and unable to hold certain things for long. It can have shooting pain or shock-like pain into these 3 fingers. And when patients sleep, they are prone to wake up. They are prone to wake up in the middle of the night because of these symptoms. And patient may have to shake the hand to get rid of these symptoms and only be able to go back to sleep. Symptoms may come when you're holding something with your wristband for a long period of time, like holding the car or driving. How frequent do people get this? About 1 to 10 people in 100 will get this. Risk factor includes like female. Female tend to get more than male. At one's age, pregnancy I mentioned just now, thyroid disease, rheumatoid arthritis, kidney failure, smoking, alcoholism, and repetitive motion activities of the wrist. And if you have a history of fracture or dislocation of the wrist, you're also prone to get this. Occupation at risk, as you see the last one, is people who use a lot of computer keyboards and mouse, work from home, they tend to get this. Besides that, people who use a lot of vibratory tools like construction workers, quarry or stone drillers, they are prone to get this. Assembly line workers like factories workers like automobile industry, clothing, shoes, electrical assembly factory workers, and food processing and packing like frozen foods, packers, fish processor, poultry workers. How do I know if I have carpal tunnel syndrome? Symptom as above I mentioned just now, and if you go to doctor, these are the few tests the doctor will do. You can be a doctor by yourself, by self-diagnosing yourself or your friend. First is Tino sign. You just tap gently on this part of the wrist, and if it produces numbness, tingling, or pain, you most likely will be having carpal tunnel syndrome. Another one, you do this test, is what we call Phelan test. You hold this position for 1 minute. After 1 minute, you feel these 3 fingers having the same symptoms or worsening of the symptoms. The third one will be a Durkin test, which is a direct compression test. You just compress this area for 30 seconds. And you're having this 3 fingers numbness, tingling, or pain. As on the right hand side picture, you can see this side of our palm usually have a muscle, normal control or bulging muscle. If you have this carpal tunnel syndrome for a prolonged period of time without seeking treatment, this muscle will be lost, or we call it muscle atrophy, and you have something like concavity here. Okay, means that your muscle is not innervated, the nerve is almost is severely injured. This only will happen in a very late stage. What investigation may be done by the doctor? Doctor may or may not do this investigation, depends on whether he is confident that this is your problem or not, like X-ray, ultrasound, MRI, or nerve conduction study. If the doctor is very confident that this is a carpal tunnel, all this investigation may not be needed. What can I do without surgery? NSAID, like I mentioned just now, is act as a painkiller and reduce inflammation. For those patients who have a lot of night symptoms, they wake up in the middle of the night because of pain, they can wear a night splint to keep the wrist at straight position so that they will be able to sleep throughout the night without problems. Activity modifications like repetitively bending wrist, you try to reduce all these activities. What can the doctor do for me? As opposed to trigger fingers, steroid injections doesn't really work for carpal tunnel syndrome. Only 20% of patients respond for 1 year, 80% of them only temporary relief. Most of the time, doctor injects steroids is used as a diagnostic test, which means if you inject a steroid into the carpal tunnel and patient have relief, means it's quite very likely you have carpal tunnel syndrome and you will respond very well after the surgery. Surgery, carpal tunnel release is the gold standard of treatment. It give you good result in early to moderate cases. If you come late in severe cases, symptoms may persist in 20% of severe patients, even with the carpal tunnel release of the surgery. As you can see, this surgery can be done under local anesthesia. It can be done under daycare setting, which means you can go home on the same day and then remove suture about 10 to 14 days. You can start moving a finger almost immediately. I can see in the pictures on the left hand side, the wound is about 3 to 4 centimeters over here. And on the right hand side, the scar heal up is not so noticeable after some time, okay? What happens if I don't seek treatment early? It can cause permanent nerve damage, which means the weakness in the muscle can be permanent, leading to permanent disability. Numbness may be permanent even with the surgery. Okay. How can you prevent this? Some of these are okay. First, you can sleep with the wrist in straight position by using brace. You can keep the wrist straight when using tool. Try not to bend it or curl it. Okay, and avoiding curling or extending the wrist repetitively. Or if you are in a job that require you to do this, you can use the other hand to substitute and give the affected hand some rest. And before the activities, you can perform some stretching exercise and take a regular break from repetitive motions, like maybe about 10 minutes every hour, especially when you're in a job that use a lot of vibratory or heavy tools. In the 10 minutes, you can do some stretching of the wrist and hand, make a fist and stretch out your fingers. Repeat for 5 or 10 times. And when you are holding, when you need to hold certain tools or typing or writing, use a gentler touch, which means don't use too much force in your fingers when you can do the same thing with a gentle touch. Third topic will be ganglion cyst. This is the most common most common mass in the hand, about 70% of hand mass. What is a ganglion cyst? It's a small sac of fluid consists of jelly-like material, most commonly occur at the back of the wrist. It can occur at the front side of the wrist or palm side of the wrist, or can happen in the hand. Occupation at risk, any job that require repetitive hand and wrist movement, but there's no evidence to support that so far. How do I know if I have ganglion? There will be a soft mass or bump which changes in size. Sometimes it can go bigger, sometimes it can go smaller, sometimes it can even just go off by itself, just to come back another time. Most ganglion cysts cause some kind of pain, okay, maybe mild pain, but up to 1/3 doesn't have any pain. They only have cosmetic issue, means that it doesn't look good, so you may want to get rid of it. Okay, but some ganglion can have limited motion, which means you will reduce your motion of the wrist or whichever joint it appear. It can cause weakness and numbness, and if patient have this kind of symptom, it's indication for surgery to remove the ganglion. What can you do? Okay, in 30 to 50% of ganglion cysts disappear by itself without treatment. So if you have ganglion and it's not causing you any problems, you can just monitor. Okay, you do not have to get treatment or see a doctor. But of course, if you are worried, it may be something else. Of course, it's advisable to see a doctor. If you see a doctor, what can a doctor do for you? Needle aspiration is one of the treatment, but this needle aspiration have high recurrence of about 50%. Means the doctor will just put a needle there and aspirate out the material. But if needle aspiration, you may need to be repeated a few times. The surgery for removal of ganglion cyst is indicated if you have painful wrist swelling, or it causing you difficulty to do work or numbness or tingling sensation. Recurrent rate is much lower, about 15 to 20%, of course, but it's still possible that it can recur, but it's lower than if you just do a needle aspiration. This surgery can be done under daycare setting or inpatient, under local anesthesia or general anesthesia, or what we call whole body anesthesia. The fourth topic will be a Quervain tenosynovitis or Quervain disease. Quervain tenosynovitis has some resemblance to a bit same like trigger fingers. When you look at here, there will be two tendons that move our thumb. Okay. Now, in normal situations, this tendon moves smoothly within its cover. Okay. So there's no problem. But when the swollen tendon, the tendon gets swollen or it rubs or the tunnel or the cover become tighter, they can cause problems and pain at the base of the thumb here, this area. How do I know I have this problem? Usually present with swelling and pain over the thumb side of the wrist, this area, okay, this area, okay, and this pain may travel into the thumb or in the forearm. The pain may get worse as you move your thumb and wrist or try to pinch or grab things. And if you see doctors, usually the patient they'll be, when you press this area, it will be very painful. And there's a test that we do to confirm or to diagnose these conditions. First, you bend your thumb, and then you make a fist, and you move your wrist towards the other position. Then you have a lot of pain over this area. Then this test is Finkelstein test, is positive, and most likely you'll be having this condition. How frequent is it? Again, it's more common in female. It's about 1.3% of female, maybe less than 1% for male. Patients in the age group of 30 to 50 years old, prone to get this. It's caused by overuse or repetitive motion of the wrist, like golfer, racket, sports, gardening, carpentry, mechanics, plumbing work, and gaming. Using a lot of keyboard and mouse again. Those who work a lot at home, from home, and using a lot of computers, keyboards, and mouse are prone to get this. And it also can be caused by trauma after injury, direct blow to this area. It can cause this Quervain tenosynovitis, and it can also happen after a pregnancy. How do we treat? Okay, these are the conservative management. You rest. When you have pain, you just rest. You take NSAID or non-steroidal anti-inflammatory drugs to relieve the inflammation. And whatever activity that can aggravate this, like sometimes you hold babies or you carry a lot of heavy things, you try to avoid these activities. A splint may be useful. You just wear a splint and you wear it for about 24 hours a day for 4 to 6 weeks. If all this doesn't work, then you need to find a doctor. Steroid injections works very well in this condition, okay, but the recurrence is common. Only if steroid injection doesn't work, then you need to undergo surgery, especially in very severe pain, patient with very severe pain. Failed steroid injection, I mentioned, it can be done under daycare setting, under local or general anesthesia. You may be able, if it's daycare setting, you can go on the same days. How do I prevent this? Again, avoid repetitive movement of the wrist, which can aggravate the pain. Reduce twitching, pinching, or forceful gripping using your thumb and other fingers. Perform stretching exercise of the thumb. And take frequent breaks to rest if you are using your wrist continuously, and wear a brace or splint of the thumb and the wrist. Last topic will be tennis elbow. Just now we're talking about wrist and hand. Now we're going up slightly higher, which is elbow. Okay, let's go to anatomy first. Movement of the wrist and hand and fingers are controlled by muscle that attach to the outside part of our elbow. We call it lateral epicondyle of the humerus bone. When this attachment get inflamed, tear, and disease, it can cause pain or movement. When you try to move this, you'll be pain and you'll be weak. This tennis elbow is the most common elbow pain. Another condition which we commonly mention is golfer elbow, which pain over the inner part of the elbow. But if we are talking about tennis elbow, which is a lot more common than golfer elbow, pain over the outside portions part of our elbow, is overuse or use too much injury, causing inflammation of the tendon or region, causing elbow pain. And because of this pain, you are unable to exert energy, so you will get weakened of the forearm and the wrist movement. Okay. How do I know if I have tennis elbow? It's usually have pain over the outside elbow, and you have weakened forearm and hand, and you're unable to lift or grasp things because of the pain. If you do this, you curl back of the wrist and you try to go against it, you have a lot of pain here. Like you have to straighten your elbow and do this test. Then a lot of pain over here and localized tenderness over here. This is how you know that you might have a tennis elbow. How frequent is it? It's about 3%. Okay, out of 100 people, 3 persons will have it. Age is 35 to 50 years old, and men and women are equally affected. Who is at risk? As per the name, tennis elbow. Tennis players or racket sport with a lot of backhand movement, they tend to get this. Manually intensive occupation like butchers, meat cutters, construction workers, and automobile assembly workers tend to get this as well. They are prone. Workers, we are involving a lot of bending and straightening of the elbow more than 1 hour per day, like plumbers, mechanics, engineers, painters, gardeners, chefs, and machine operators. What can I do without surgery? Activity modifications, NSAID, and physiotherapy. You can do a stretching exercise. Later, I will teach you that stretching exercise later on. And there's another brace that you can wear, which is quite useful. We call it counter force brace, as in the pictures. You wear this, and also ultrasound treatment in the physiotherapy. What can a doctor do for you? Steroid injection success rate is high. 95% of patients can resolve with just steroid injection. If this steroid injection fails, then you need surgery. How do I prevent this stretching exercise of the wrist and forearm? These are a few things that you can do. That you put a rubber band over your hand and try to stretch it. This is one thing. And second thing, you do this exercise, or do this exercise, or do this exercise. If you can hold it for 5 to 10 seconds and do about 20 times in the morning and night. Okay, and avoid repetitive movement of the elbow. And when you do certain things, you try to take the stress off the elbow by using more of your shoulder and upper arm power. Okay, thank you. With this, so if there are a few questions from Sandy Wong. Yes, your dad will have this kind of fingers will happen in the morning after he wakes up. He doesn't have diabetes, just have hypertension. This means he has bigger fingers. If he have this kind of clicking or pain over here, or nodule or swelling, or he always have this clicking or unable to easily bend it or straighten it, yes, he might have trigger fingers. So I advise him to do the stretching exercise I mentioned just now, the exercise. Okay, and hold every position for about 5 to 10 seconds and do about 20 times every in the morning and at night. He might just recover from that without any surgery. Okay. Hi, for Maggie Lee, is restless leg syndrome a symptom of neurological problems? Restless leg, it would be good if you're able to give me more explanation about what do you mean by restless leg syndrome, because it's a very general term. Restless leg syndrome can be due to a neurological problem, and can also be due to a vascular problem or blood vessel problems. Okay. So it would be good if you can provide me with more information about the symptoms that you or your family or relatives having. Okay. From Nazifa Razak, doctor, I have a problem which whenever I move down the ring finger or other fingers are still stand straight. I don't know why my little finger cannot stand straight like this. Oh, okay. Is that if there's no pain, it can be a normal phenomenon, because some of our tendon, they are attached, they have some communication. So if you bend your ring finger or the four fingers, your little finger may not be straight completely because of the communication of tendons. If you have pain or some symptoms, then it may be a different thing. But if there's no pain, no problem, or no history of injury, no other symptoms, it may just be a normal thing because of the communication of tendons between these two fingers. Okay. Cracking sound from Liz Lee. Thank you for your question. Is cracking sound on the joint, for example, in the leg or spine, a sign of osteoarthritis? Cracking sounds when movement, or you mean the cracking sound from the joints or from any part of your body? It can be a sign of osteoarthritis, especially if you can hear or feel some movement in the knee joint. The most common osteoarthritis in the body is knee osteoarthritis. So when you straighten your knee or bend your knee, you can feel the sound or cracking sound. Yes, it could be a sign of osteoarthritis. Spine also, yes, if you hear cracking sound on your back, it could be a sign of osteoarthritis, but need further investigation. Sound alone may not warrant a treatment. All right. Hi, from Zaini Zai Ahmad. Thank you for your question. Is there any possibility after treatment or surgery the symptom will appear again or no? Which diagnosis are you talking about? If you're talking about trigger fingers, usually it won't recur again. If you're talking about carpal tunnel, it might reappear if the release is not if the surgery is not completely released. It means the carpal tunnel, the fascia, is not completely released. So if you talk about ganglion, yes, there's about 15 to 20% recurrence rate. If you talk about recurrence, if you do the surgery, usually it should resolve by itself without any recurrence. It'll be good if you can tell me which condition I'm talking about. Thank you, Zaini Zai Ahmad. Is there any other questions? So far, there's no more other questions. So I will end this webinar. So Selamat Hari Raya, and please maintain your hygiene, wash hands regularly, wear your face mask, and maintain social distancing. Selamat Raya Fitri, and have a great holidays, everyone. Thank you.